My name is Moulton. I am the surgical lead for Cognition and Culture. Cognition is the way we think, and culture is attitudes and beliefs that are held within a group of people that then can influence the way we think as individuals. We see many times that they are linked in healthcare. We are trying to put cognition and culture on the map and create a program or an infrastructure for being able to study it, being able to affect change.
The surgical culture is traditionally fairly hierarchical.
It's one human interacting with another in a high-stakes environment.
As a trainee coming into surgery, I was always fascinated by surgery. I was always fascinated by the surgical culture and the swagger of a surgeon and the bravery of a surgeon. And then coming into surgery, I had feelings that were not all fearless and brave, and I wondered whether other people did. I could see that they might be wanting to call for help, but there was a resistance to call for help. I could see that they were scared, but they didn't say they were scared. What I started appreciating was that surgeons started talking about their reputation and their ego. They wondered, or they worried about what other people might think about them if they were to call for help too much. Can they actually admit that they don't know something? I started appreciating that it was more than just a cognitive phenomenon, and that we are embedded in a very powerful culture in surgery.
And we've under-recognized the importance of both individual variability, but also the variability in the interactions of the team members and the direct impact on the quality of care and the outcomes in patients.
There's an opportunity for us to continue to try to enable respect, enable equality of conversations, really listen to each other deeply, and that's going to enable safety and well-being and inclusion and a really strong sense of belonging, which is going to be very helpful for all staff.
Anytime you can create a better functioning team and a healthier, happier workforce, you will have better patient care. If we can teach and promote the healthcare providers getting in touch with their human side rather than having to kind of put on a front about who they are, I think that is very good for the patients.
So of course the patient is the most important person in the operating room that the team is working to help. We also have to pay as much attention to our staff at UHN, whether it's nurses or doctors or perfusionists or allied health personnel. And working in a healthy, constructive, respectful environment will certainly allow for more people to want to come to work at UHN and to stay working at UHN.
I think this is so important for nurses because nurses really want to feel connected in. They want to feel a part of that exceptional team. And they show up every day to do their best work for patients and families. And this is going to take us to that next level of care.
This initiative has never been done elsewhere. This is actually very unique to UHN.
This is another example of the innovation that's being adopted at University Health Network.
We have an opportunity to be the best in the world, and that these new ideas that are going to push us to the next level of our ability as teams, as care providers, as individuals who are really committed to creating the best environment to enable the best care outcomes.
We can be trailblazers in this area and really define the future of culture and cognition in the operating room, in the hospital, in the healthcare environment.
Dr. Moulton is a world-class expert, and she's the perfect person to lead us forward to becoming really attuned to these issues of culture and cognition.
We're very lucky to have Dr. Moulton, who's an international leader in the scientific examination of these dynamics and the unique features that the operating room brings to this.
Knowing that we are all doing such great work and trying to do such great work, but we are affected personally by this culture that interferes with our interactions with other healthcare team members, trying to make a difference and trying to not just understand it, but actually affect change. It's very exciting.